So now we will begin our academic session of the day. Before we start, let me briefly walk you through today's Learn format. This morning session will cover 3 topics with 20 minutes allocated for Q&A session on each topic. For participants who joining us online, please submit your question in the Q&A section provided in the Zoom later. In this first session, under the theme of Foundation of One Health, we will be led by our very first moderator, Dr. Marcelinus Edwin Widionto Daniwijaya, Doctor of Philosophy, Specialist of Microbiologist. And I would like to briefly explain the resume. He is a lecturer and researcher in the Department of Microbiology, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. He is also an expertise in clinical virology, microbiology, immunology, and molecular diagnostic. His focus research in viral genomics, molecular epidemiology, and infectious disease. He is still actively developing the use of the next generation sequencing or NGS for disease surveillance and diagnosis. So everyone, please join me in welcoming Dr. Edwin as a moderator.
Right, sorry for the technical problem. So this is our first speaker, Dr. Navneet Dhand, and his resume is quite extraordinary because he's a director of the Asia Pacific Consortium of Veterinary Epidemiology in the Asia Pacific region, distinguished veterinary epidemiologist over 20 years, and he is recognized as a research leader in veterinary medicine, consultant of animal projects, food and culture in the FAO and the World Health Organization of Animal Health. We will have the speaker present for around 20 minutes, and I think that we will directly respond to the Q&A after the speaker has presented his speech. So, Dr. Navneet, are you online today? Are you ready?
Thank you. Can you hear me?
Yeah, morning. Can you hear us here?
Great. Can you see my slides and hear me?
Not yet, but can you, I'm sorry, we want to confirm. Yeah, now we have the slides already shown on the screen. So, Dr. Navneet, I think that if you're ready, you can present your PowerPoint, and we have around 20 minutes for your presentation, and we will respond to the Q&A after the speech. So, Dr. Navneet, we will give the time for you to present. Please, you can start. Thank you.
Thank you. Thank you. I had 14 minutes of slides, but I can stop, wherever your time finishes. That doesn't matter. So thanks everyone and for joining, and thanks to the organizers for inviting me for this talk. It's always a pleasure to collaborate with UGM and speak with our students there. So Chris asked me to talk broadly about emerging infectious diseases, and as this is just the first day of your school, I will be presenting a sort of overview, and then I guess further details can be presented by other speakers following me. So we will go through this outline. We will talk about emerging infectious diseases, what are the drivers of these diseases, and how can you tackle them. And then I will end up with the workforce development work that we have been doing to tackle emerging infectious diseases. All right, so I guess all of you are aware of what emerging infectious diseases are. So these are the infections that have recently appeared within a population or whose incidence of geographic range is rapidly increasing. WHO warned in its 2007 report that the infectious diseases are emerging at a rate that has not been seen before. And since the 1970s, over 40 infectious diseases have been discovered, including SARS, MERS, Ebola, avian influenza, swine flu, Zika, and and then COVID-19. So you can see that they are emerging at an unprecedented rate. What is common among these emerging infectious diseases is that more than three-quarters of them have an animal origin. So more than 75% of the emerging infectious diseases originate from domestic and wild animals. So what usually happens is that they usually spill over from, they originate usually in wild animals, then spill over from wild animals to domestic animals, and then from domestic animals to humans. So they are spreading from sort of wild animal to domestic animal to humans. So as you can see that most of these threats are not just human diseases, not just animal diseases, or just an environmental problem. So they are all three at once. And that's why we need to deal with them and we need to tackle them at all three angles. We need to be able to work across all three sectors to prevent them, detect them, and respond to them effectively. So this is pretty much the sort of central theme of the talk today. Is that these are not problems of a single sector. These are multi-sectorial problems affecting human health, environmental health, and animal health. And to deal with them, we'll have to work together. We will have to collaborate. We can't keep on working in our silos. So take some examples. That Hendra virus, it is the flying foxes are the reservoirs of the virus. The virus then spreads to horses, and from horses it infects in contact humans. So you can see that the connection between human, animal, and environment here. Take another example closer to you of the Nipah virus outbreaks in Malaysia and Singapore, and more recently in India this year. So in 1998, there were several outbreaks. They occurred in Malaysia and Singapore and resulted in deaths of more than 100 people and mass culling of more than 1 million pigs. So fruit bats were the reservoirs of the virus, and the bats roosting in fruit trees on pig farms transmitted the virus to pigs that came in close contact and then caused outbreaks in pigs, and which became the animal reservoir, spreading disease to humans in close contact with them. So you can see the link here, from the wildlife, domestic animals, and human. So human, animal, and environmental interfaces are so important. So if you have to tackle this, you can't just deal with humans. You can't just deal with animals. You have to deal with the whole system together. Another example of avian H5N1 influenza in several countries in 2003. It resulted in culling of millions of poultry birds. Here in Vietnam, Indonesia, Thailand, Laos, Cambodia, Myanmar, and had a significant effect on the poultry industry. And as you can see that SARS also occurred in the same year, affected several countries in our region. And then it also emerged from bats and spread to humans via civet cats and resulted in more than 8,000 human cases and over 700 deaths. So again, you can clearly see the link between human, animal, and environment when emerging infectious diseases are concerned. Then coming to 2009, H1N1 pandemic influenza. This virus was a sort of cocktail of viruses from birds, pigs, and human, and it caused a lot of scares at that time. Remember, people stopped eating pork, really thinking that people this is going to cause the disease. And then more recently in our times in COVID-19, we don't know the intermediate host, but more likely spread from flying from bats to some intermediate host, and then spread it to humans, and then there was human to human transmission. And this H5N1 in cattle, this clade is happening right now. There's a spillover from wild birds to cattle, and then eventually there was cow-to-cow transmission and spread to several states in the U.S. Through this transmission, and also there was sporadic cases in humans. So you can again see the link there. And this Ebola virus is actually happening right now. This is also, transmission happens when um, people consume either bats or, meat of animals that are fed on bats, or by bush meat hunting when they come in contact with the infected wildlife. Again, you can clearly see the link there. So that's what I was trying to say, that most of these threats are intersectorial. They are not just human, not just animal, or not just environmental problems. They are all three at once. And you need a One Health approach to tackle them. You will have to deal with them, in all these sectors together. You can't just handle them in one sector alone. So now again, coming to now the drivers of these EIDs, what is driving, why they are emerging. So in the first section, we learned that they are emerging at an unprecedented rate. We have seen examples of several emerging infectious diseases in the past several years. But why they are emerging, what is causing the emergence of these drivers? Because understanding the drivers is important, because if you understand what is causing them, then you can prevent them, then you can tackle them, then you can detect them, right? So let's see what is causing these emerging infectious diseases. So it is a complex problem. It is a confluence of several factors, including rapid population growth and urbanization, which is sort of leading to land use change and encroachment of wild habitats. As the population increases, and you know that so does the demand for food and housing. And to meet this demand for food and housing, we are clearing forest and encroaching into wild habitats. So with this increases the connection or interaction between wildlife and domestic animals and humans, and bring them closer, which increases the potential for these pathogens or to sort of cross species barriers and spill over from animals to humans. So you had a clear example of Nipah virus, Nipah virus pig farms expanding into the bat inhabited areas there, and that put fruit bats, pigs, and farmers in close contact, causing Nipah virus outbreaks. Another example, in Australia, the habitat loss pushed the flying foxes into horse properties in Australia. So the horse properties where they are now, the flying foxes are living on on the horse properties, where they had bat urine and birth fluids are contaminating the pasture and their water, and that spillovers from water and pasture to horses, and from horses it can infect the in contact human. So again, sort of caused by that housing and urbanization and habitat loss. That's another factor, is the intensive animal production. The pigs, particularly in pigs and poultry, so they're housed close together. They're similar animals. It's much easier for a disease, a virus, or pathogen to transmit between animals in densely populated pig and poultry farms. So it makes the emergence of the diseases easier. So another factor is the trade and travel. There is an increased cross-border trade of livestock. As you know, there's an end of wildlife. It has been estimated that millions of wild animals cross borders each year for use as pets, for use as food, for use as traditional medicine, which again increases the likelihood of contact of wildlife and domestic animals with human and a recipe for disaster. So, as we similarly we see so that in Ebola virus there is a sort of connection with hunting and bushmeat consumption. And once there is a disease outbreak, it's much easier to spread via international travel, as we saw during COVID outbreak, COVID pandemic, that the disease spread throughout the world in a few months. And we saw recently in the H5N1 in cattle, in the disease spread due to interstate movement of cattle in the US. So trade and travel, of course, is necessary, but then they also lead to spread of the disease and emergence. Climate change is another driver that is affecting the emergence. So that is affecting in two ways. One is the expanding of the vector habitats. So the warmer temperature and changing rainfall patterns allow the mosquitoes, the ticks, and the other disease-carrying insects to thrive in new regions. So they couldn't thrive in cold climates, but then the temperature in those areas is now going up, and they are moving to those areas and causing diseases there. The other effect of climate change is the extreme weather events like the floods, the droughts, heat waves. They disrupt ecosystems and bring humans into closer contact with wildlife and pathogens. So this is directly causing these is a direct driver of these emerging infectious diseases. So, as you have sort of seen, starting from population, housing, urbanization, deforestation, intensive production. So, all of these exploitation of wildlife, travel, climate change, you can see it is not a single sector problem. It is not a problem of humans directly. It is interlinked problem. Everything is all in connected together. So if you try to tackle it from one angle, it's you're likely to be successful. So that's why we need to use this One Health approach. And One Health approach, we need to collaborate with the people from other disciplines, and we need to learn to work with other disciplines. That's now how our systems are set up. You would see, human health ministries and animal health and environmental health ministries are sort of set up separately. And in almost all countries, that's how they work. And it's very difficult to sort of work with others because they have their own budget, they have their own aims and goals, and their own problems they want to solve. But the issue is that unless we work together, unless we collaborate, it's unlikely that we will be able to tackle them. So coming to how tackling of emerging infectious diseases, can I ask about the time? Is that going okay?
You still have 20 minutes, Professor.
Yeah,
so it's okay. Yep.
Thank you. So now we learned about what emerging infectious diseases are, and then we learned about what is actually driving them. Now let's go to understand how we can tackle them. And to tackle them, there are lots of frameworks that have been prepared globally as well as regionally. And I've copied their screenshots there, and you should go and sort of download and learn what they are trying to say. But if you put them all together, they sort of boil down to those three things. So you want to prevent them from occurring, of course, and then if you can't prevent them, then you want to detect them early. And once you have detected them, you want to respond effectively. So prevention, early detection, and rapid response are the sort of hallmarks of all these guidelines and frameworks available globally as well as regionally. So they have, of course, multiple other components within them. But if you want to simplify it and summarize, you can say these are the three key features in how we can tackle them. And all of that also sort of leads to disease preparedness, where I will talk about that in a minute. So how can we prevent them? So prevention is very closely linked to the drivers. So we understood that these are the drivers for emerging infectious diseases. So prevention is basically acting on the drivers. So one of these things is that this is a UN report prepared by the United Nations Environmental Program. And it's a good read. I would recommend you to go and take a copy, download a copy. So it's basically talking about the same things that we discussed. So if the diseases are caused by habitat destruction, then habitat conservation and restoration is the solution. And if it is caused by land degradation, then you should reverse that land degradation, promote ecosystem health, end wildlife trade and consumption, regulation of wet markets, monitoring of food systems, farm sustainably. But as you can see that all of these are quite challenging issues. You want to do that, but they are not something that you can do tomorrow. These are long-term things, and it requires a lot of effort and willingness of everyone globally to handle them. In addition to that, there are some things that we can certainly do is biosecurity in animal production, for example. We can enhance that. We can reduce the wildlife in livestock interface and improve land use. We can certainly vaccinate animals like Hendra, for example, in Australia, vaccination of Hendra in horses, and rabies, for example, you can vaccinate dogs. Vector control is actually happening in Yogja. It's a really good example from Yogja. And we didn't talk about the antimicrobials. That's another issue which is also sort of linking human, animal, and environment, and that you could do antimicrobial stewardship. So prevention certainly possible and is far cheaper than response. But it's most of it is not in the human health domain. It is most of it live in the animal and environmental sector domains. But some of these things that are required for prevention, like these ones, these are quite challenging to implement. But as long as you understand that that's how you would prevent them. If you tackle these drivers, that's how you would prevent them. But what we can really do is early detection and rapid response. So detect them early on if they emerge, and then respond effectively. Right. So now how can we detect them early? And we learned that majority of the emerging infectious diseases have an animal origin. So if that is true, then what is the best way to detect them early? How can we detect them early? So the best way to detect emerging infectious diseases is at the animal source or at the animal human interfaces at this level, when they are in the wildlife spilling over to domestic animals, not here when they are already in the human population. So if you want to detect them early, you will have to detect them in the wildlife or in the domestic animals. So To be able to do that, you need a trained workforce. Not only you need veterinarians who are trained in detecting disease early, you need environmental people, wildlife people who are trained in detecting disease early. You need good surveillance systems in animal and environmental systems. So the detection, if you want to detect early, then it has to happen at this interface, not at the human interface. So you want to detect the diseases here at this stage to protect the general population. So disease is emerging at the animal interface to protect the general population. And you are actually leaders in one of these things to why you have your eye sickness system, which is actually quite novel and world leading, I would say, particularly in developing country. I haven't seen that kind of well set up systems established and run. So you should be proud of that. You already have this sort of surveillance system that is connected from field veterinarians, para-veterinarians up to the central level, and it is sending data, and you're collecting a lot of data. Of course, there are issues with it, like it's not as good as it can be. There is a lot of issue with how the data can be analyzed or better information can be gained. But Indonesia is certainly a leader in this space. The other thing to think about in surveillance is collaborative surveillance, because the real power of surveillance comes from joining it up. So humans are conducting their own surveillance, animal veterinarians are conducting their own surveillance. If they are not connected, it will be very difficult for us to detect diseases early. Die-off in wildlife, abortions in livestock, cluster of fevers in a clinic can be just one outbreak, can be just one emerging event. But if they are all being tackled differently by different ministries, while in the data is in different surveillance systems which are not talking to each other, then it will be very late by the time we will know about them. So there is a lot of talk about collaborative surveillance in WHO and FAO and WOA at the moment, to try to make sure that these systems talk to each other, and to actually establish systems that have data from both animals and humans. But it is not easy to do. It's because animal data is very different from human data. So we talking about farm level data, and the human is usually individual animal data, and there are a lot of issues about privacy and sectors. So it's quite a complex issue to implement, but this is the goal. That's where they want the global leaders want us to go to have a collaborative surveillance system. So, well, then the detection, then the next step is to respond to it. And to respond to it, we need to sort of understand how to investigate outbreaks, how to, and for that, you need to train your workforce to conduct outbreak investigations. Again, that sort of leads us to the same theme that all there are three domains. There is a one system. You have to deal with them all together. And preparedness is another term that is used. And preparedness is the your readiness of your country, for example, to deal with emerging infectious diseases. So these are the capacities that you develop, the systems that you develop, the plans you develop, and the people that you train to tackle these emerging infectious diseases. So that something emerges, then you are already ready to deal with it. It's like developing a fire brigade during the peacetime. You don't develop a fire brigade when there is fire is already on, right? So you develop a fire brigade before the fire is on in the peacetime. So this is preparedness is like doing that. So it is like developing your surveillance and laboratory capacity. There is these are the your eyes of the system and the diagnostics, the trained workforce, which are your people, and this is the most important layer here. And the plans and protocols and simulation exercises, sort of knowing who will do what and drilling it so that when there is an event, then you can actually tackle that. Having stockpiles and supply chains and logistics of vaccines, PPEs, diagnostics, cold chains, all of that. Financing so that you know which funds to use, contingency funds that you can release fast. Your governance and coordination, the emergency operation center, a clear command of chain, so you know who will lead the coordination of the event. Risk communication and community engagement is really important. That the trust you need to develop the trust before you need it. So preparedness is all of that that is built before the outbreak. But most important thing in this is I trained workforce, a workforce that is trained to conduct surveillance, a workforce that is trained to conduct laboratory examinations. That's the centerpiece of it. And that's what we are going to discuss briefly now. So what we are doing for workforce development and UGM is at the centerpiece of that. So Asia Pacific Consortium of Veterinary Epidemiology is we established that in 2020 to build exactly that, to build the workforce capacity for preparedness, to build the capacity of the animal health workforce in the region for the early detection and rapid response to infectious disease outbreaks. So we are in our second phase now. So it is a consortium that involves all vet schools of Australia and New Zealand and representatives from 8 countries in the region. So, and UGM was a member, a founding member of EPCO, and it is also still a member, and it's a key member that has contributed significantly to all the activities that we have conducted. We have an advisory committee represented by international organizations, and we are funded by the Indo-Pacific Center for Health Security. In the first phase, we have developed a training package of 36 e-learning modules and case studies across these 6 competencies on outbreak investigation, surveillance, risk assessment, One Health, biosecurity. It was a huge undertaking. So these are all the authors and co-authors involved in developing them. You would be able to see some of the people from UGM here. And we launched that in 23 at the World Health Summit, and now it is the most comprehensive open access training package of field veterinary epidemiology globally, and available in 6 languages, including Bahasa. So using this training package, in the last project, we trained 93 trainees from 7 countries, 7 countries. And in this, then we have a second phase now. In this phase, we are training 80 people, including 20 from Indonesia in this phase. The training is in 3 phases. We have an online training using these online learning modules, and then followed by hands-on field projects that they conduct in their country on outbreak investigation, on surveillance, on risk assessment. And then we have workshops on study design and manuscript writing linked with them. This is the Indonesian team. I'm grateful to them for being involved from the outset and contributing significantly to the EPCO activities. All right, so the take-home message is 4. I would say that emergence is occurring at the human-animal environment interfaces. We have seen several examples of this and how these are occurring. And emergence is will continue to accelerate because the drivers are still there. We are not we are not tackling the drivers. So all the drivers that we discussed are there. So as long as the drivers are there, the emergence is going to continue. So what we can do is to prevent, detect, and respond. We discussed that. We know how to tackle it. We know how to tackle it. All the global and regional frameworks sort of agree on that framework. But the gap is the preparedness. And we need to be prepared to tackle that and to prepare them. As I talked about several things, but people are the central theme here. So you need to prepare your people to be able to work in labs, work on plans and financing, and a workforce that can investigate outbreaks, that can conduct surveillance, analyze data, conduct risk assessments. That is required. So the message is that emergence is inevitable. These are going to continue to emerge, but we need to be prepared for it. So I'm asking you to be the One Health workforce that the country needs, that the region needs. Thank you.
Thank you, Dr. Navneet. Yeah. All right. So we have around 30 minutes for Q&A, and I think that's a very excellent and insightful presentation on how infectious disease continue to emerge because of the interaction between human environment and also the animals. So if the audience here have any question, you could just raise your hand and state your name and where you come from and give this question to directly Dr. Navneet. Yeah.
Okay. Good morning, everyone. My name is Muhammad Aksen Suldra. I'm from Indonesia, especially Southeast Sulawesi. And now I'm a medical laboratory technology. Professor, you mentioned that preference depends on people. In your opinion, how can medical laboratory technology move beyond diagnostic testing and become active contributor to surveillance and outbreak prepared within the One Health framework? I think.
Yeah, thank you very much. Yes, I talked mainly about epidemiology, but that's only one piece of the puzzle. So laboratory technicians and laboratory scientists have a great deal to contribute in diagnosing emerging infectious diseases. And you have a great role to play. I guess what is required is that training laboratory technicians and scientists in diagnosing these diseases early on, and also collaborating with animal laboratory technicians and animal scientists, laboratory scientists, to understand their perspective and understand how diseases are happening in animal populations. I think that One Health approach is so important, and thank you for joining that. And then you are already on the right path where you are joining this One Health UGM course, and that's quite helpful because now you are working with learning together with veterinarians and people from other sectors, and this will develop connections. That will develop partnerships that will go beyond this workshop. So that will help you collaborate with the other sectors. So understanding the problems of the other sectors is important, and that you will get here. But then collaborating with everyone is so important, and this is the first step that you have taken. Thank you.
Does that answer your question? Okay, thank you. So anyone else from this audience? I think from the corner over there.
Hi everyone. Hi, Navneet. So I'm Duala, I'm from Yogyakarta. So since emerging infectious disease is a complex, wicked problem involving not only human, animal, and environmental sector, but also the culture, the economical, and the psychological aspect of people. So I wonder to what extent One Health should involve social scientists such as anthropologists or sociolog or maybe communication experts, not only in the risk communication and engagement level or the governments and coordination, but maybe much more earlier, maybe from the beginning. What would you say if maybe we could involve the social scientists to complement the expertise of microbiology or medical scientists to map out since the beginning to identify from the contextual, the cultural, economical, social, uh, so to identify why such disease emerge in
Yeah.
location.
Exactly. And you have said it better than I can say. So, yes, these are so important, social scientists and all these people with communication and social scientists are very important. I actually learned this early on when I had an equine influenza project. We had an equine influenza outbreak in Australia, and we developed an epidemiology project in how the disease outbreak is spreading, what is causing the outbreak, so understanding how the virus is spreading from one horse property to the all sort of technical side of things. But ultimately who implements the any control program, any biosecurity thing, then any program you develop, the implementation is by humans, not by machines, right? So we realize that we need to better understand what horse owners think. We can develop a good control program based on the based on disease epidemiology, but we need to also understand what works and what doesn't work. So if the horse owners are not implementing, for example, biosecurity, then whatever design you develop is not going to work. So I had then two PhD students, one working on the epidemiology side of things, and the other person actually working on understanding the horse owner behavior and the psychology, and that was so important. And since then, I have involved a psychologist and collaborated with them in almost every project that I have implemented. We had actually a project on Hendra virus, specifically focusing on horse owners, and a longitudinal study on horse owners for 4 years to understand why, what are their perceptions and what are their. So vaccination, for example, in horses was a major issue, and one of the things we found that the horse owners, they are not vaccinating against Hendra because they think that vaccine can reduce their performance. So we then actually conducted a study to understand whether there is a reduction in performance due to Hendra virus vaccine, and we objectively confirmed that there is absolutely no effect of Hendra vaccine on performance. So it is a collaboration between these two sectors, and multiple sectors is so important. So when I'm saying human, animal, and environment, these are just the several the centerpieces, but then the professionals are required. Are a variety of professionals are required, and social science is very important in all of that.
Does that answer your question, Dwala? Okay, thank you. Now, I think we have questions from the online participant. So this is the question.
Yeah, that's a really good question, and it's a really good example of One Health an interface between animal, human, and environment. So antimicrobial problems are not just human health problems. So there is widespread sort of use of if we want to tackle antimicrobial problems, we'll need to tackle them at all three levels, right? So we will have to work with our veterinarians, work with our farmers to educate them about the use of antimicrobials, the effects of these antimicrobials, also to reduce the you use of antibiotics in humans. So, for example, then there is so much environment. The fish is basically living in water. So it is a really a good example of how animal and environment and human health are interlinked, and how we can tackle them. And then there is a lot of work being done in antimicrobial stewardship in many of the countries. And the latest data from VOA is actually indicating that the use is coming down. So this is one of those problems where it's a bad problem, but it is inspiring to know that things are reverting. We are changing things based on the work that we are doing. So there is a lot of work needs to be done. Of course, I'm not an AMR expert, and you will have a lot of other people sitting there. But what is required is that collaboration that I mentioned between human health, environmental health, and animal health people. And because all these problems are multi-sectorial, these are not problems of a single sector. And also social scientists, why farmers are using antibiotics, why people are taking antibiotics, why they are available, for example, to use. A lot of social and psychological issues need to be investigated. So it is a good case study that where actually One Health can be applied directly.
Okay, so that is the two questions, and one more from the Zoom online, I think. Yep, please can you put it up on the screen, or yeah, we have Sunda Satar from Philippines. Okay, you can directly ask Dr. Navneet for your question.
Hello, sir. Thank you so much, Dr. Navneet Dhand, for your insightful presentation. And thanks to UGM and all organizers for this wonderful opportunity. Thanks all. It's truly honor for me to be part of this course. My question is, I live in a rural village, in rural or village communities. How can local people be practically involved in simple and affordable ways, effective ways to support disease surveillance and early outbreak detection? This is my question. Thank you so much.
Thank you. That's a really good question. And I actually grew up in a village in India. And I can tell you, you are from Pakistan. I can say that we have a very similar
Yes,
culture.
I'm from Pakistan.
Yeah. So village people actually live with animals, right? They are not
Yes.
where animals are not living in farms. And I can, we had animals living in our. If you go to any house, you would have people and animals living together. So people in
Yes.
India, in villages, would come to know about any problem firsthand. And we were developing a project where we would actually communicate. We were training women in villages, because they are the most. They are the people who actually handle animals most. to train them to provide first-hand information about disease in humans and animals. So, for example, if their child is sick, but also their animal is sick, they would be the first to know. And we developed actually project to um, train them. Unfortunately, that didn't it was funded, but then it was withdrawn. But that is the way to. So I think the people in rural areas already practice One Health. They are already have a close connections. It is more to capture that information from them.
Yes.
It's more to engage them in this early detection and surveillance.
Yes.
Thank you.
Thank you so much, Professor. Thanks so much for your detailed answer. Thank you so much for your time.
Thank you.
Okay, thank you, Sundaras. Anyone else from the Zoom? One more. Oh, it's from the questioner. So, Dr. Nafit, can you read this question, or should I read it back
Yeah.
to you?
Yeah, I've answered that. The second one, yes. All right. Given the global need for animal protein, the risk of the new disease emergence from that's a really good one, and that's why I said it's not easy to tackle those drivers of emerging infectious diseases, because we also need food security, we also need protein. But what we can do is we can have a system where we have a good biosecurity. We have certain guidelines for how farms are managed, how farm animals are kept. And biosecurity would mean that the diseases are if the disease emerges at a farm, then it can be contained in that farm or in that village. And biosecurity would also mean that it's less likely to then transmit it to other villages and other countries. But also, if you have biosecurity, it's much more less likely to be transmitted to humans, because you have you are using proper hand washing techniques. You are using not allowing visitors to come in contact with farmer. You're using PPE to when you're handling animals. So biosecurity is one of the answers to those problems. We still need protein, right? We still need food security, but we know that the intensive farming are causing problems. So from intensive farming, we need to sort of move towards sustainable farming, and proper biosecurity procedures.
Okay.
While still ensuring that we have enough food to feed our people.
Okay. Dr. Nafit, can you give the previous question? One more question. Okay, so there's another question from Daifullah Abian, Indonesia. Dr. Nafit, can you explain given the Indonesia is one of the most largest fishery producer, how can antibiotics used in aquaculture sector trigger antimicrobial resistance, or AMR, which impacts public health? What are the public strategies and measures to address antibiotic dependence in this sector?
Yeah, a great question. And the antibiotic use in aquaculture is a problem because that is actually, as I say, it is causing antimicrobial resistance, which is impacting human health. And these, I would say, these give the same answer. So if you have good biosecurity, you would need less. You would need less use of antibiotics. If you can use those biosecurity approaches that are specifically designed for aquaculture, you would have less disease and less use of antibiotics. But also there are There are obviously guidelines and frameworks available to tackle antimicrobial resistance. And I can put you in touch with my colleague who is actually has a project in Vietnam and in probably also Indonesia and dealing with antimicrobial resistance in aquaculture. It's a big issue, but there it is tackleable once you have to deal with all these biosecurity issues in aquaculture.
Thank you. So I think we still have around 10 minutes for the Q&A. Anyone from the audience would like to give a question? Sorry, there's 1, 2, 3.
Hello, good morning, everyone. Good morning, Professor. So regarding the Nipah viruses, as you mentioned before, I have two questions regarding the pathway of transmission. So as I understood, as you mentioned before, the pathway is from wildlife animals into the domestic ones and then to the humans. So especially for Nipah viruses, from the fruit bats and then to the pigs and then to the humans. So I'm wondering, so is there any domestic animals that we need to be taken care of rather than pigs? Or is there any domestic animals like which can be infected rather than pigs from the bats? And then my second, oh, you would like to answer the first?
Yeah, go on, ask. Yeah.
Okay, so my second question is like for the transmission, for the pathway, without involving the pigs, the intermediate, like the source, the host, like can it be directly transmissioned from the bats, the natural host, to the humans?
Yeah, for
Thank
the
you.
Hendra virus, it hasn't. We haven't found that in Australia that the virus is transmitted directly from flying foxes to humans. So they're transmitted via horses. But Nipah virus is something that for in the recent outbreaks where there was a connection with the use of with a direct connection with wildlife or coconut trees and when people are collecting that sap. There was a connection of with direct connection with bats and wildlife. I'm not sure of any other intermediate host, but there is for Nipah virus has been shown that there is a sort of direct connection. But in Hydra virus, it hasn't been confirmed from directly from flying foxes to humans.
Okay, thank you.
Dr. Navneet, I understand you have a meeting at 10, so is it possible for one more question? Or should we end this one?
Yeah.
Okay, so one more question, just one, sorry.
Good morning. My name is Mazaya and I'm from Jakarta. Thank you, Dr. Navneet, for the explanation. So my question is a bit related to the previous question. So we usually know the disease is when it reach the domestic animal. For tackling EID, like what you said before, we should detect early in wildlife to domestic animals, right? Like usually what I see, like we know the disease is when it reach the domestic animals, like some are dead, like in the poultry or our livestock. And I'm wondering, like, do we need to detect before that? So we need to detect like in the wild animals. So before we do quarantine or vaccine to the livestock, so we can detect the disease like even before that, or that's the earliest thing that we could do, like in this current situation.
That's a really good question. So if we can, so there are two angles to it. Can you detect them early in wildlife? Yes, you can detect early in wildlife if wildlife is monitored, and there are rangers, for example, who can tell you about some deaths in So, for example, deaths in pigs or deaths in wild birds, that could probably indicate something going on with the. And then people have seen in Vietnam, for example, when there are deaths in a forest area, and then there are the diseases actually spread in the surrounding villages. But what you are saying that is also correct. It's much more easier to monitor our domestic animals because they are in our constant vigil, right? You are in contact with them. You can know that they are showing clinical signs, whereas wildlife is challenging. So yes, you have to do at both of them if you can, if you have a service system in forest areas to surveillance them, that's fantastic. But and that can also give you an early sign that something is going on, and they could prevent. Then you can act early and if you can tackle that outbreak, for example, in the forest area, then it doesn't sort of spread over or spill over to surrounding villages and animals. But what you said is perfect. That in domestic animal we have a more chance of detecting them. That's why it is so important to train our veterinarians, train our para-veterinarians to be aware of the clinical signs and diagnosis how to of these diseases. And it's so important for our farmers to report these diseases, and is a central piece of the surveillance system. So yes, both.
Okay, thank you. Can you give another round of applause for Dr. Navneet for his presentation? Thank you, Doctor, for the excellent and valuable insight on this topic.
Thank
So
you.
I think you have to have another meeting. So thank you very
Yes.
much for participating from the Australia. See you next
Thank you
time
so
on
much.
the next on your next venue of One Health. Okay, so I will give another small information. Maybe we have a short coffee break for around 15 minutes. So I hope everyone will have a coffee breaks beside this room. But I'm sorry we cannot bring this coffee and snack into the room. So we'll be starting the next session on Professor Dr. Sri Wibowo at 10:15. Okay, thank you very much.
Sorry, I just
Yes,
shared a link to it just shared a link in the chat to a NIPA article I had written during the sort of recent outbreak in India. So just sharing that link in the chat.
Okay, thank you very much. Okay, so see you next time, Navneet, and thank you very much for your participation. Okay, so we can go to coffee break.